Welcome back to Mindful Objective, the show where we explore health through an integrative and practical lens. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today, we're talking about two natural enzymes that people are starting to hear more and more about. That is nattokinase and serrapeptase. These are tools that help support circulation, inflammation, and the body's natural cleanup process. Even though they sound unfamiliar, they can be simple and approachable once you understand how they work. So, nattokinase supports healthy blood flow and helps body maintain a smooth and steady rhythm in that circulation process. Serrapeptase helps clear out old proteins, reduces congestion, and supports easier breathing and tissue recovery. People feel lighter, clearer, and more balanced when these areas improve. So, in our practice at Mindful Objective, we use these supplements when someone shows signs of slow circulation, lingering inflammation, sinus pressure, chest tightness, and recovery that's often delayed. They are not treatments for disease. They are supportive tools that help your body do what it's already designed to do. In this episode, we'll also talk about what these enzymes are, how they work in simple terms, the signs that someone may benefit from them, the functional labs that provide deeper insight, and integrative steps that help these supplements work even better. As always, this show's for educational purposes only. We do not diagnose, treat, or cure any illness or disease. So now let's go ahead and dive in. So nattokinase sounds complicated, but the idea behind it's pretty simple. It comes from a traditional Japanese food called natto. When soybeans ferment, a natural enzyme develops inside the food, and that enzyme is nattokinase. People take it as a supplement today because it supports circulation and helps the body maintain steady blood flow. This is important because how well your body moves that blood affects everything throughout your day. Your energy, your mental clarity, your warmth, even the way you recover after exercise, stress, and long days at work. So imagine your bloodstream as a river that runs through every part of your body. When the river flows smoothly, everything moves the way it should. Oxygen reaches your brain, nutrients reach your muscle and organs, waste products and toxins are carried away so your system stays clear. When that river backs up or gets sluggish, it gets thick, the whole environment starts to feel different. You might feel heavy in your legs. You might notice pressure in your head. You may mentally be foggy, tired, or simply cannot get going when you even slept well. So nattokinase gently encourages this river to stay moving. It supports the body's natural ability to break down proteins, especially protein called fibrin, that can make the blood feel thicker when there's way too much of it. So this does not mean nattokinase is a blood thinner or a drug. Instead, it helps maintain natural flow so the body can bring things that it needs to your tissues and carry away what it no longer needs. For many people, this shows up as better energy, that more awake feeling, and less heaviness on your body over time. So you may also hear people mention nattokinase when they talk about cysts, or fibroids, or adhesions. Some of these tissues have fibrous outer layers that include fibrin. Because nattokinase supports the body in breaking down that extra fibrin, some practitioners and supplement makers suggest that it may help support comfort in areas where there's a lot of tight fibrous tissues. For example, you may see it in formulas marketed for pelvic congestion, fibroids, or ovarian cyst support. The thinking is that when circulation and fibrin improves, pressure and discomfort may lessen. It's important to be honest about what science does and what does not show. Right now, the strongest research on nattokinase is about circulation, clotting balance, and blood pressure. There are human studies showing that it can support the natural breakdown of clots and help maintain healthy blood pressure over time. The research on shrinking cysts or fibroids directly right now is limited and it's early. There are patents and theories out there, but not large human trials providing that nattokinase consistently reduces cyst size. Because of that, we talk about it in a way that support flow and comfort around tissues, not as a treatment for cysts themselves. At Mindful Objective, we use nattokinase all the time. When someone shows clear signs that the circulation could use that support, or, maybe their hands or feet are always cold. Maybe they feel a tight band of pressure around their head. Maybe their energy crashes in the afternoon or feels heavy, dragging, and sensation in their legs go day after day. By the end of the day, you're tired. Sometimes the same people also struggle with fibrocystic, breast tenderness, or pelvic congestion. When we improve circulation and overall flow, they often feel lighter, clearer, and more at ease in their own body. One of the things people appreciate about nattokinase is that it works quietly in the background. You don't feel wired or overstimulated. Instead, over several weeks of consistent use, you may notice changes that seem small at first, but these add up. Your fingers feel warmer. Your brain feels less weighted down. your recovery is a little faster throughout that long day or that workout. When you pair nattokinase with good hydration, daily movement, nutrient rich food, it becomes part of a simple, steady plan to help your body move and clear the way it's designed to. Now let's talk about serrapeptase. Serrapeptase is another natural enzyme, but the story starts in a very different place. It was first discovered in silkworms, where it helps dissolve part of the cocoon so the moth can break free. When scientists studied this enzyme, they noticed that it could gently break down certain proteins in a body that are no longer needed. The supplements used today is not taken from insects. It's produced in a controlled environment to match the same type of enzyme, so it can be used in a safe and predictable way. To understand serrapeptase, picture your body as a home that you lived in for many years. Over time, the home collects things. Dust in the corners, boxes that are meant to be sorted, older decorations you no longer use. None of these items ruin the house, but they add clutter and make it harder to move around comfortably. The body can't collect clutter too. When inflammation builds up after stress, injury, irritation, the body is left with extra proteins and debris that need to be cleaned up. Serrapeptase helps support that natural cleanup process. It does not remove living tissue. Instead, it helps your body break down non-living protein material that's no longer needed. So this is why serrapeptase is often used for sinus congestion, chest tightness, and that stubborn inflammatory discomfort in your body. When mucus, thick secretions, or leftover inflammatory proteins build up, people start to feel heavy, tight, and blocked. Serrapeptase supports the body in clearing that buildup, and so those tissues feel less swollen and more open. It does not work like a numbing pain reliever. Instead, it works in the background, helping reduce that extra material that contributes to discomfort in the first place. You may also hear serrapeptase mentioned in conversation about cysts or that fibrocystic breast changes, endometriosis, or pelvic adhesions. The reason is very simple here. Many of these conditions involve thick, fibrous tissue and repeated inflammation. Because serrapeptase helps break down certain non-living proteins and reduce swelling, some people use it in hopes of softening tight areas that ease around those cysts. There are small studies and reports showing that serrapeptase can reduce swelling and pain in certain situations, such as breast engorgement and ear, nose, and throat problems. However, these studies are limited and they do not prove that serrapeptase directly shrinks cysts, fibroids, or those growths. What it may do is reduce inflammation and the pressure around those tissues, which can still bring meaningful relief. So again, in our practice, we use serrapeptase when someone describes feeling inflamed, congestion, backed up, and it may be from sinuses or chest or that soft tissue issues. A person may say their nose is always stuffy, even when they're not sick. Another person might describe tightness in the chest during certain seasons. Someone else might feel tender, that feeling of that real tender breasts during that cycle of their month. When we support their body with serrapeptase along with lifestyle changes such as, again, hydration, minerals, gentle stretching, anti-inflammatory foods, many people begin to feel more open, comfortable, and relaxed in those areas. We are always careful with how we explain its role. We do not tell people that serrapeptase will ease cysts or fibroids. Instead, we explain that they support that environment around those tissues by reducing inflammation, helping clear out those old proteins. This, in turn, may ease pain, pressure, and swelling. Medical imaging, diagnosis, and treatment decisions still belong to their doctor and their OBGYN. Our goal is to help the body feel and function better while the medical side is being properly managed. We work together, hand in hand. So serrapeptase works best when taken on an empty stomach so it can circulate without being used up digesting food. Many people take it first thing in the morning with water and wait at least 30 minutes before eating. You could do this right before bed also. A lot of times people do the second dose later in the day in between those meals, right? Between lunch and dinner. When combined with good hydration, daily movement, and deep breathing, serrapeptase becomes a gentle tool that helps the body keep doing what it's doing, that cleanup work. Over time, this can translate to that easier breathing, less pressure, better mobility, and quieter, calmer sense of inflammation throughout the body. So now let's talk about when these enzymes may help and when they may not. So when you hear about supplements like nattokinase, serrapeptase, it's easy to wonder if they're right for you. A good way to think about this is to see where they tend to shine and where they clearly have their limits. So these enzymes are helpers. They support the body's natural system. They are not a magic solution. They're not a replacement for medical care, imaging, or basic lifestyle choices. Those are all still needed. So people who may benefit from nattokinase often show signs in their circulations not working smoothly as it could, right? There's always a way to improve. Their hands and feet are cold even when there's normal indoor temperatures. They feel heavy or dragging sensation in their legs after sitting or standing for long periods. They feel tired or foggy in the afternoon even if they slept all night. Some people describe a tight band of pressure around their head or eyes. When we see this pattern, it suggests that the river of blood is flowing through the body. It's working harder than it should. So supporting healthy flow with hydration, movement, minerals, and when appropriate, nattokinase can bring that gentle, noticeable improvement in your body. So now on to serrapeptase and people who may benefit from serrapeptase. This is often those that feel congested or inflamed. Their sinuses are always full. They deal with ongoing pressure behind the eyes or in their forehead. They have chest tightness that flares up during certain seasons. Their muscles feel stiff or sore longer than they should after activities. Some people experience tender breast tissue, especially before their cycle or during their cycle, or a sense of swelling and sensitivity in areas affected by endometriosis or past surgeries. So in these situations, serrapeptase can help support the body's cleanup by clearing out those old proteins, that old material, by reducing swelling, which can make tissues feel softer and more comfortable. So cysts are a big one, right? Serrapeptase and nattokinase. A lot of people know these because a lot of people utilize these to help clear cysts. So cysts are an area where people have a lot of questions. It's important to be careful and clear here. Some cysts, fibroids, and adhesions have fibrous component, and these tissues can be surrounded by inflammation. Because nattokinase supports fibrin balance and serrapeptase supports protein cleanup, some practitioners and supplement companies suggest that they may help people feel better when it's related to that cyst and that cyst discomfort. From a realistic standpoint, the best way to talk about this is that these enzymes may support circulation inflammation around the tissue, which can reduce pain and pressure. So current research does not prove they are reliable in shrinking cysts or fibroids in humans. Most of the strong evidence is for circulation, that clotting, balance, and swelling, which is not a direct removal of the cyst. So this is why at Mindful Objective, we frame these enzymes as part of an overall support, not the main answer. If someone has ovarian cysts, fibroids, or that pelvic mass of any kind, they need proper medical evaluation and imaging. Their OBGYN or specialist should be involved in any decisions about surgery, medications, or even monitoring. So if we use nattokinase or serrapeptase in those situations, it is with the goal of helping the person feel more comfortable in supporting their body's natural system while the medical team handles diagnosis and those treatment decisions. There are times when these enzymes are not a good fit. Anyone taking prescription blood thinners or strong anti-clotting medications need to talk to their prescribing doctor before using nattokinase or serrapeptase. People with a history of bleeding problems, stroke, or clotting disorders need medical guidance first. These supplements are usually stopped before surgery because they can influence how the body handles clotting and inflammation. Pregnant and breastfeeding women should not use them without working closely with their healthcare provider since safety data is limited in those situations. It is also helpful to remember that these enzymes are slow, steady tools. They do their best working over weeks or months, not days. The people who do the best with those who already work in their foundation, this is what they're there for. Drink water. They eat nutrient-dense foods. They support their body. They do a lot of movement. They work on stress and sleep. When these fundamentals are in place, nattokinase, serrapeptase often feel like an extra layer of support that helps everything run more smoothly. So now let's talk about how we use these supplements in our practice here. So inside Mindful Objective, we take the intention and practical approach of using supplements like nattokinase, serrapeptase. But before we even think about adding an enzyme, we want to understand who the person is in front of us. We look at their daily habits, their stress levels, their sleep, their digestion, their movement patterns, and their current symptoms. When appropriate, we also review functional lab testing that gives important insight on those inflammation markers, nutrient status, and circulation-related patterns. Only after we see this and look at that full picture is when we decide if we're going to use these enzymes as part of their plan. So many people reach out to us because they feel stuck. They tried eating better, they tried to exercise, they even taken generic supplements from a store. They still feel off. They still feel heavy, tired legs. They may still be struggling with sinus pressure that never fully clears. They may feel tender breast tissue month after month or have a history of endometriosis, that pelvic surgery, or those adhesions. They may be describing feeling inflamed, puffier, and congestion, even though their basic labs look normal. These patterns that the body is trying to move blood and clear inflammation, but could use that extra support. Nattokinase often comes into the picture when circulation is clear, part of the problem. If someone has cold hands and feet, afternoon energy drops, brain fog, or that band of pressure on their head, we consider whether their internal river is flowing the way it should. We talk through hydration, electrolytes, posture, movement, and even breathing. If those basics are being addressed and their symptoms continue, nattokinase may be introduced as a way to support that healthy flow. In some clients with fibrocystic breast tenderness or pelvic congestion, we also find that supporting circulation helps reduce that heavy sore feeling, even though we're not claiming to change the cysts or fibroids themselves. Remember that. Serrapeptase usually enters that plan when inflammation tissue congestions are front and center. We know exactly what's happening. This might be someone with year-round sinus pressure, recurring chest tightness, lingering soreness after activities. It might also be someone with a history of fibrocystic breast changes, endometriosis, surgical adhesions, who still feel stiff, full, and sensitive in certain areas. When we add serrapeptase, we explain that we're not dissolving living tissue. It is supporting the body's natural ability to clear old and non-living protein debris, reduce swelling in soft and tight inflamed areas. For many people, this translates into easier breathing, less pressure, and more comfortable relationship in their own body. We also are very clear with clients that these enzymes are not standalone answers, especially in cases involving cysts and fibroids. We encourage everyone with pelvic pain, breast masses, and any growth out there to closely work with their doctor or OBGYN for imaging and that medical guidance. Our role is to support comfort, flow, and inflammation balance and lifestyle patterns, while the medical side is handled by their licensed provider. When both worlds work together, people feel more safer, more informed, and more helpful. So practically speaking, we introduce those enzymes slowly. We might start with a low dose of nattokinase first thing in the morning on an empty stomach and ask a client to track their energy, warmth of their hands and feet, and overall sense of heaviness over a course of weeks. If serrapeptase is added, we give it its own window, right? Also on empty stomach. This way that the body can use it systematically rather than just when your body's digesting food. We adjust timing and dose based on how the person feels and how their lifestyle and labs evolve. So these supplements are always paired with that foundation. We work on sleep routines so that the body can repair overnight. We adjust nutrition so that protein, healthy fats, and minerals are in place. We encourage daily walking and gentle movement to keep lymph and that blood flowing. We support stress regulation through breathing exercises and realistic routines. So in that context, the nattokinase serrapeptase become part of a thoughtful plan instead of random pills in your cabinet. We want to do it right. So now let's talk about how to think about adding them into your life, right? How, as of today, do I need these? Will they help me? These are common questions. So if you are considering nattokinase and serrapeptase, it helps to approach them with calm and thoughtful mindset. These enzymes are tools, not the magic fix like we discussed. When you understand that realistic, right, you want to be on that realistic level, you can use them in a way that supports your body instead of creating stress and unrealistic expectations. Start by getting clear on what you're feeling. Are your hands and feet often cold? Do you feel heavy or tight in your legs when sitting or standing? Do you notice brain fog, afternoon crashes, or a sense of pressure around your head? These are all signs circulation may need support, and they point to more towards that nattokinase. On the other hand, do you struggle with sinus congestion that never clears? Do you have chest tightness during, certain seasons? Do you feel tender, ropey breast tissue that's ongoing and you have a lot of sensitive areas from old injuries, endometriosis, or even old past surgeries? Those patterns suggest inflammation and tissue congestion are more of an issue, and they point towards serrapeptase. So if cysts and fibroids are part of your story, it's important to keep things in perspective. These enzymes may help support comfort around those tissues by supporting blood flow and helping your body manage inflammation in that old protein material. But people sometimes notice less pressure, less swelling, and fewer sharp pains in areas that once felt tight and, angry in your body. And this is meaningful. At the same time, current research does not show these supplements reliably shrink cysts or fibroids in humans. For that reason, imaging, diagnosis, and treatment decisions should always live with your doctor at OB or your OBGYN. So think of nattokinase and serrapeptase, again, as that supportive background tools, not the main solution. Next, think about your foundation. It is tempting to jump straight into supplements and skip the basics, but the basics are where most of the progress happens. Are you drinking enough water? Are you getting regular movement, even if it's just daily walking? Are you eating enough protein to repair tissue? Are you including colorful fruits and vegetables that provide antioxidants? Are you sleeping enough hours at night? These simple habits make a huge difference in how well the supplement works. Huge, huge. If after looking at your foundation you still feel drawn to these enzymes, start slow and simple. Take them on empty stomach since it's when the body is most likely to use them systematically. More people often start with that low dose, once a day, give their body at least 2 weeks before deciding how they feel. Some people choose to add a second dose later. Pay attention, though, how your body responds. Keep a simple journal of energy, warmth, congestion, pain, and your mood to see how these patterns keep going rather than guessing. Be sure to talk to a qualified healthcare provider if you're taking any prescription blood thinners, if you have a history of bleeding problems or preparing for surgery or pregnant or breastfeeding. Share the exact name and the dose and enzyme supplement with your provider on what you're considering. It's always better to have a medical team aware of what you're using, especially when products that may influence circulation and inflammation. Above all, keep your expectations gentle. Nattokinase serrapeptase tend to work slowly and quietly. You may notice those small changes at first, such as warm fingers, easier breathing, less pressure behind the eyes, better recovery after workouts, maybe even feeling calmer in those tender areas. Over time, these small shifts can add up and makes you have more comfortable life. When you combine these tools, though, with those good daily habits, proper medical care, you give your body the support it needs and what it's designed to do. Let your body heal itself. In the end, integrative health is a partnership. You listen to your body, you work with your providers, you choose tools that make sense for your situation. Enzymes like nattokinase serrapeptase can be part of the set of tools that help your body move, clear, and repair a little more easily day after day. So as we wrap up this episode, remember that nattokinase serrapeptase are not quick fix solutions. They are steady support that helps your body clear what's no longer needed and helps maintain that healthy flow. When circulation improves and inflammation settles, people begin to feel changes that reach far beyond one symptom. Energy improves, breathing feels easier, recovery feels smoother, clarity returns. We have had a lot of success with serrapeptase nattokinase, a lot of success stories out there. I mean, even though there's not research on cysts and stuff like that too, there's a lot of feedback from people saying, it really helped them throughout their life. And it kind of removed a lot of things from their body. So it's worth taking a look at. But if you have never looked at markers related to inflammation, clotting, or nutrient status or blood flow, this may be a good time to review those. These labs give context to your symptoms and help you understand why the body may feel backed up or heavy. You can also reach out through our practice if you want to help with functional lab testing, supplement recommendations, or a tailored plan that supports your specific needs. Again, everybody's individual. All of our needs are different. So thank you for listening to Mindful Objective. The best healthcare is proactive and integrative. Keep learning, take consistent steps towards better, and stay curious about what your body's trying to tell you. And as always, remember this information shared here is for educational purposes only and should never be taken as medical advice. Always speak with your qualified healthcare provider before making any changes to your health routine. See you next time. Stay well.